Good morning. I'm Julie Pastrick, President and CEO of the Greater Flagstaff Chamber. Today, we're going to hear more about the Rehabilitation Hospital of Northern Arizona. You know, the one up on the ridge. Sometimes you can see it, sometimes you can't, on Cedar. Welcome to Susan and Destiny.
Thanks for having us.
Yes, you're very, very welcome. I have had a lot of interaction with the Rehab Hospital, but let's begin by telling our listeners the main goal of the types of patients you are serving.
So, a lot of people don't understand what type of rehab that we offer. The most common diagnoses are CVA, strokes, so brain injury, spinal cord injury, amputations, multi-trauma, ortho, and we have many other people that we serve to get back to their prior level of function.
Great. You know, I did know that it was patients that have stroke and that have had some type of a procedure at the hospital but weren't ready to go back to their home and needed some inpatient service. And you're a 24/7 physician oversight facility. How many beds?
We have 40 beds, and we actually have 7 days a week physician coverage. So we have a physician in the building 7 days a week.
And that's so important. And I know you have an internal medicine physician, a medical physician. Let's talk a little bit about the types of services you offer, like daily education classes or the team conferences with the whole multidisciplinary idea of how do I get discharged? What are the goals? Destiny.
So that's the one special thing about rehab is that it is a multidisciplinary approach. So once a week we meet together, nurses, physicians, therapists, respiratory, dietary, everybody gets together in one room and we meet about every single patient at least once a week. It is amazing, and it's something that you don't normally get in any other level of care. We also invite families to be a part of that because education is huge, so we can get those patients back home.
I think when someone has had a stroke or a major accident that has impaired their functionality, that's all there is from their loved ones is questions. How? What's next? Why did this happen? And all of you understand there's certain steps and ways to relate, correct?
Correct. And so that's why family is so important. We don't want to discharge our patients home only for them to go back to the hospital. We want them to go home and stay home.
Well, and so when your patient comes in, is it a little bit of everything? Is it physical therapy? Is it speech therapy? Is it learning how to walk? Is it getting limber again? Let's explain to our listeners the gamut of what the doctors and nurses and caregivers are providing.
Yeah, so it's a little bit of all of that. Our patients that come in need to require two different therapy disciplines, meaning we have physical therapy, occupational therapy that focuses more on the things they have to do to care for themselves, and speech therapy, which is swallowing, talking, cognition. So they must require at least two of those different disciplines. But we also have pull therapy and some other kind of fun things like that that get the patient stronger.
So Destiny, it's really easy for you and Susie to talk about this. It's not easy for a layperson to talk about brain injury or amputation or spinal cord injuries. Where in your heart does that just mountain full of kindness come from to rehab these patients?
You know, for me personally, every single patient that we discharge from our hospital, we line up in the halls. We make an announcement on our overhead speaker. We line up in the halls and we clap for all of them. And so you see them get wheeled in on a gurney or a stretcher. And then, 14 days later, they walk out. And there's just something that you can't miss that feeling.
So I would think, too, that as they're being released and everybody's clapping and it's a very cheerful, joyful time, there's probably still a lot that has to happen in the home and the therapy continues with the family. How does that relationship work? We're speaking with Destiny from the Rehabilitation Hospital of Northern Arizona. Only been in Flagstaff for about 5 years now?
3, actually.
See? 3.
Yeah.
I'm so bad with time that I would have said 3 thinking it's 5 because I always forget about how long something's been around. And so we're so happy that we have this type of facility because the hospital is a trauma care center. So you're getting a lot of those trauma patients.
We are. And you mentioned family. Education is huge. Again, we want our patients to go home and stay home. So we train the families. We let them come and stay with patients when needed because we want to set them up for success. We don't want to send them home with their loved one that they don't know how to take care of.
What makes you certified to deal with stroke or spinal cord injuries or multiple trauma? What does that take for the accreditation of Rehabilitation Hospital?
So we're stroke certified by the Joint Commission. So they came into our facility. They looked at how we took care of our stroke patients. They looked at different charts. They worked with our patients, and they said that we were worthy of a stroke certification. Yeah.
That's great. And then would the same be relevant for trauma, because the trauma is so diverse?
Yeah, we don't have a special certification per se, but our staff is trained, and we do a really good job rehabbing those patients back to their previous level of function.
I think this might be a question for you, Destiny, from the Rehabilitation Hospital of Northern Arizona. What are some of the benefits of coming to the hospital? You know that a lot of people, once they've been to the hospital or to their caregiver, then to you, that's it. They don't have to get readmitted. And that's such a big deal. Could you explain that better to us?
Yeah, so preventing readmissions is our number one goal. So I mentioned the family training. We do education classes every day for our patients. We teach them, besides just taking your blood pressure pills to control it, how can you do it with exercise? How can you do it with diet? How can you prevent yourself from having another stroke or a brain injury? Super important things. They also get to discharge home with greater independence. So we work on like bowel and bladder, making sure that a patient can go out to dinner with their family and not have to worry about having an accident. Those things that people normally don't think about.
So probably that party in the hall when they're discharged, all of this has been learned and has come to a certain level that it's time for that start of the independence after a traumatic event.
Absolutely. We also have what's called our TOPS program, Transitional Outcomes program.
Oh.
And the purpose of that is to prevent readmission. So our case managers work really hard to give extra education to all of our staff saying this patient is high risk, let's enroll them in this program. And then the case managers follow up with the patient. So a day after discharge, a couple days after discharge, and then they follow them typically up to a month after discharge from our facility. They make sure that they go pick up their medications. They attend their follow-up appointments. It's just kind of that nice extra security for them. And then if they have a problem going home, they can call us right back and we'll help them.
I think it's really great that there's only 40 beds because most hospitals have hundreds of beds and the patient care is, of course, fabulous. But then when it comes to rehab and needing that one-on-one, is that typical or atypical? Why did Rehabilitation Hospital of Northern Arizona choose to be 40 beds?
So it's purposefully built to be smaller. We don't want to be one of those 100-bed hospitals. We want to be able to focus on our patients, their individual needs. We want to know their families, kind of know their story, and you can give them more individualized attention that way.
Well, that's what I was thinking. I'm just so happy and pleased. We've had a great working relationship with you through the years, even before the hospital was built, bringing the Navajo Nation in to talk to the administrators of how referrals from the Navajo Nation could happen, the local hospital, etc. Did we forget anything? We're at the end of Chamber Business Buzz. I'm wondering if there's anything you wanted to add before we close. How can families reach you? What's the best way? Should we go online to your website?
Yeah, we have a Facebook page, so it's the Rehabilitation Hospital of Northern Arizona. They can reach us on there. I watch the message board pretty closely. They can go to our website and definitely reach us that way and just give us a call. They can come by. We can offer them a tour. We have virtual tours we can send them if they don't want to come out due to COVID. There's lots of ways that they can reach us.
That's perfect. Well, thank you, Susie and Destiny. We really appreciate you taking time. I think our listeners have a much better understanding and awareness of the wonderful services and the improvement of quality of life you make for so many. Keep it up. We're really grateful.
Thank you.
Thank you.
And thank you, ladies and gentlemen, for tuning in. It is one of those great days that we are learning things that we probably didn't know behind the scenes at the Rehab Hospital of Northern Arizona. It's Julie Pastrick, the president and CEO of the Greater Flagstaff Chamber, your host. So honored to sit in with you. Remember, our 4th of July parade is taking place this year on Saturday, July 3rd. Independence Day parade, Saturday, July 3rd. Get your entries in today, and we'll talk again later. I'll see you again next time on the radio.